Hello and welcome to another episode of Dollar Store Surgery. In this episode, we show you how to replace an arthritic hip with an artificial joint. The patient is the leg that was built in a prior episode. As always, the materials you need are listed at the end of this video. There is also a somewhat quirky student version of this episode as well. Enjoy the video. The overall process is to cut off the neck, ream the acetabulum, and drill the proximal femur to expose the medullary canal so we can implant the artificial joint. To expose the hip, make a skin incision along the proximal femur and cut the capsule along the neck. Saw along the base of the femoral neck just medial to the intertrochanteric line. Externally rotate the limb and you will be staring right at the acetabulum. Ream the acetabulum and be sure to remove any dust formed by the process. When the particulate falls on the floor, it can be very slippery, and the dust is just a mess in general. It coats everything. Now turn your attention to the proximal femur and begin by drilling along the axis of the medullary cavity. Progressively widen the hole with larger bits and go slow. It is important that a member of your team hold onto the distal femur to stabilize the limb. Do not hold the femur anywhere close to the hip. In some cases, the drill bit will break through the bone and you don't want the drill bit to hit your hands. Continue to use the drill bits to shape the femur. With larger drill bits, it will be easy to see the particles of bone flying away from the surgical site. Be vigilant with the vacuum. When you think you are ready for a dry fit, tap the femoral component into place. Be gentle. It is very easy to fracture the bone with the wedge-shaped femoral implant. If you do fracture the bone or the implant won't fully insert, remove the implant and continue shaping the interior of the femur until there is a good fit. You don't have to get things perfect because bone cement acts as a mold and a buffer between the metal implant and the softer bone. You can pack the femoral cavity with cement or coat the implant or both to secure the femoral component in place. Fractured femurs should be stabilized with a zip tie to close down the fracture. Use firm pressure to fully seat the implants into position. The simulated cement will likely ooze out between the implant and the bone. Use a finger or instrument to remove any excess cement. Ensure that the components restore the natural kinematics of the hip. The center of the artificial femoral ball should be located at the same approximate location as the center of the native femoral head. Likewise, the acetabular component should be secured in approximately the same location as the original acetabulum. If done correctly, the ball should be stable in the socket with little help from the surgeons.